All right, let's talk about diffuse gastric cancer. So 47-year-old woman presents to the PCP, got the persistent bloating, early satiety, mild nausea. She's had a recent aversion to meat and she's like feeling really full really quickly. The CT scan shows diffuse thickening of the gastric wall with a discrete mass. We have poorly differentiated cells with an intracytoplasmic mucin displacing the nucleus to the periphery. Okay, we should be thinking of two types of gastric cancer. There's our diffuse, which is what we have here, diffusely thickened, rigid gastric wall with a leather bottle appearance. This should make you think of the signet rings, and we'll see an image of this here down below. Boom, there it is. So our signet rings, and I'll show you some other examples here. Signet rings, you can see, looks like a little ring. There it is on the side. So that's our diffuse gastric cancer. There's also another type of intestinal cancer, and that's where a lot of these other answer choices will be, like A, ulcerated mass with heaped up margins and central necrosis. That's gastric ulcer or gastric or just intestinal type gastric cancer, and it has a gland forming columnar and cuboidal cells with central necrosis. So it's not going to be that, because our histology is just going to be closer to this leather bottle appearance. And so on the step, they'll show you something like this, and they'll be like, boom, what is this? And then you'll see the signet rings, and you'll think diffuse gastric cancer. And these are how the symptoms might present. So here we have early satiety, weight loss, diffuse thickening of the gastric wall, and without a well-defined mass, and then the signet rings. And so let's look at some other answer choices, like A, ulcerated mass with heaped up margins. We talked about that one. The central necrosis, that's going to be intestinal. C, multiple sessile polyps. That would be familial adenomatous polyposis. So that's the FAP. And we should be really familiar with how this polyps formed, and then also Peutz-Jeghers. It could be another answer for C, or a relation to C. Solitary exophytic lesions with glandular formation. That would be another intestinal type cancer. And rugal thickening of the stomach and punctate mucosal ulcers would be Zollinger Ellison with the gastrinomas. Yeah, and the hypertrophic rugae. So it wouldn't be the signet ring cells. So that's this super important pathognomonic stuff. Signet ring, leather bottle, for the symptoms that you see with the gross appearance of the rigid thickening stomach wall. And that would be diffuse gastric adenoma, not the intestinal type. So if this was helpful, then go ahead and like and subscribe. Thanks so much.